Sleep is essential for well-being. Exactly like that with the capital letters. People are searching for solutions to feel better, going to see a doctor to get rid of their low mood, irritability, and using stimulants like coffee and energy drinks to fight fatigue, instead of just concentrating on solving sleep issues. My name is Darina, and I'm running a psychology blog for a happier living. Let's go! Ongoing sleep problems can affect physical health, mental health, and quality of life in general. So what are the key features of insomnia? They are difficulty falling asleep, difficulty staying asleep, or waking up too early despite having the opportunity to rest well. For insomnia to be diagnosed, sleep difficulties must have been present for more than 1 month. Other common symptoms of insomnia include fatigue, tiredness, lack of energy, problems with attention, concentration, memory, difficulties performing work or care after somebody, making mistakes while working, while driving. It's low mood, it's irritability, it's tension, headaches, problems with digestion, it's daytime sleepiness or feeling tired with no reason, it's worrying about sleep or about functioning the next day. This one is actually a really big one because it activates the vicious circle. I worry that I would not sleep, I'm not sleeping, I'm tired, I'm worrying again, and so on and so forth. Recording this video, I just realized that, gosh, looks like all our problems in life because of not having a good sleep. Anyways, let's continue. So what are the main causes of sleep problems? Many things can cause insomnia, but probably the most obvious and often for all of us is stress and worry. What else? Significant life events. By the way, it doesn't necessarily have to be negative events. It can be positive events also, such as wedding or an oncoming trip, but it is more about the level of arousal. So how excited we are and how our nervous system is stressed. Next one, changes to shift work or changes to your routine in general. And the final one, changes in home life, which can be a newborn baby in a family, for example. For most people, once a period of stress or change has passed and life has settled down, sleep returns to normal. For others, however, sleep problems can continue. Certain health and lifestyle factors can also affect sleep. For example, caffeine, cigarettes, alcohol, some medications, and some drugs. Environmental factors like noise, light, too warm in a bedroom, too cold in a bedroom, other health concerns such as asthma, bronchitis, and chronic pain. Other sleep-related disorders that might cause the person to feel restless, such as restless leg syndrome, or which might affect the person's breathing while they are asleep, for example, sleep apnea. Mental health issues such as anxiety and depression can also affect our sleep in a very negative way. So what to do? This is what probably interests most people who are searching for some answers on the web. Cognitive behavior therapy for insomnia, CBT-I, is the most widely used and effective psychological treatment for insomnia. Contrasting with sleeping pills, CBT-I helps you to overcome the underlying causes of your sleep problems. CBT-I made up of a number of different techniques which are described below. First technique, learning that your bed is for sleep only. People with sleep difficulties sometimes use their time awake in bed for activities other than sleep, such as reading, watching TV, and using electronic media devices like e-books, smartphones, etc., which can stimulate the brain and make it harder to fall asleep. Using bedtime for these other activities can also reduce the connection the brain makes between bed and sleep. In stimulus control therapy, clients are encouraged to use their bed for sleep only, sex being the exception, rather than for other activities that stimulate the brain and interfere with sleep. People with sleep difficulties also often lie awake in bed and then sleep in, preventing them from developing a good sleep routine. In sleep restriction therapy, a strict bedtime and wake time routine is set up to minimize the amount of time spent in bed awake. For example, if a person usually spends 8 hours in bed but only sleeps for 6 of those hours, they would be set a schedule of going to bed for 6 hours only and waking at a set time, even if they wanted to sleep in. Gradually, as sleep improves, the time spent in bed is also increased. Second technique, practicing helpful ways of thinking. Worrying about sleep or not sleeping can make getting to sleep even harder. Cognitive therapy helps the person identify these unhelpful thoughts and to find more helpful ways of understanding sleep and coping with sleep-related stress. Another technique, learning relaxation skills. Relaxation skills training involves teaching the person a variety of techniques that help calm the mind and the body. Techniques such as progressive muscle relaxation, breathing exercises, and guided imagery are used to reduce mental activity such as worry that does not give us a chance for a proper sleep. Guided imagery is focusing the mind on a positive, soothing images. Next one, practicing sleep hygiene. Sleep hygiene refers to a set of behaviors and habits that can increase the length and quality of your sleep. Good sleep hygiene practices include making changes to your bedroom to make it more comfortable space to sleep, decreasing activities before bedtime that can interfere with sleep, and improving a range of lifestyle factors that support sleep. So what are those sleep hygiene practices? Take a pen and paper and note them down. Do not panic, as some of them seem quite difficult to do at the first glance. But it is all just a matter of a habit. It actually takes an average of 66 days, it's just more than 2 months, to form a new habit. Let's wrap it up, guys, and try to sum up everything we talked today about. So, sleep hygiene practices are: use your bed only for sleep and sex and not for other activities such as reading. Make sure your bedroom is quiet and dark during your sleeping hours. Make sure your bedroom is a comfortable temperature, not too hot and not too cold. Avoid using electronic media such as the computer, television, smartphone, etc. at least 1 or 2 hours before going to bed. Avoid coffee, tea, and other caffeinated drinks during the afternoon and evening. Avoid alcohol. Cut down or stop smoking with help of medical practitioner. Sudden attempts to stop smoking and nicotine replacement patches can affect sleep. Exercise regularly, but avoid exercising immediately before sleeping. Get up at the same time, even if you had trouble sleeping the night before. Try not to worry about whether you are going to sleep well or no. Perform important tasks that require you to focus and concentrate during the day rather than in the evening. Practice relaxation or mindfulness techniques when going to bed to help calm the mind and the body. Gently focus on your breathing while you breathe in and breathe out. This is super simple but super effective technique to calm down. That's it for today, as I like mentioning that to know is not enough. It is actually the actions that Bring the result and solve the problem, not just a theoretical knowledge. Share in the comments section what you tried already and what techniques you find the most helpful, or maybe some of them just not for you. Don't forget to subscribe to my YouTube channel, follow me on my Instagram and hit the like under this video. And I will see you soon.